Karibuni sana, Dr. Karanja Mwangi, consultant obstetrician and gynecologist. We continue with our new session to ask your gynecologist any questions, and we'll be able to answer you where we can. This is our second series, so I'll be taking questions and answer them randomly. So today our first question, I think that the two questions are related. So the question is, can one balance hormones without taking medication? Then number two, what causes hormonal imbalance, especially if you don't have a family history and you're not on any contraception? Now, hormonal imbalance is a vague term or a layman's way of talking about the hormones that control the menstrual cycle. And also we have other hormones which are not related mainly to the menstrual cycle but do affect the menstrual cycle. So when you're told your hormone is imbalanced, most of the time what people mean is either your periods are irregular, you're having heavy menses, you're not receiving your period, so you'll be told you have hormonal imbalance. But in real sense, medically, if you say hormonal imbalance, we have to look for the hormones, specific hormones that could have a problem. Either they're too high or they are too low. Because if they're high or low, then your menstrual cycle will be affected. The other bit would be in terms of not specifically a disease, but if you're too stressed, because most of the hormones are controlled from the brain. So if you're too stressed, let's say work, or you lost someone very close, or you're undergoing marital issues, those ones can cause hormonal imbalance and menstrual irregularities. If you just join the gym and you're doing very strenuous exercise, or the opposite, you are in the gym very active, then you suddenly stop, that can cause hormonal imbalance. If you increase weight suddenly or reduce your weight suddenly, that can cause hormonal imbalance. And also change of weather and climate can also cause that. Let's say you're in Mombasa and you travel to Nairobi, because of the sudden change in weather, you find that either your periods come very early or there's a problem in the hormones. And sickness or getting ill can also change your hormones. You realize sometimes when you get sick, either your periods are delayed or they come early. But those are temporary causes of hormonal imbalance. So you need to see your doctor so that he can know specifically what is causing the imbalance in the hormones. Question number 3, does IUCD is a coil, the coil for family planning. Does a coil cause you to have extra discharge? How often should I get it checked? So let me start with the second part. How often should I get it checked? We shall advise after you insert the coil, it's good to do an ultrasound scan, because when you're putting the coil, it's a blind procedure. So you need to do a scan to confirm it's in the right place. Then of course after 6 weeks, then after that it depends. You can be doing either annual scans, or if there are specific symptoms, you'll be told if they happen, you need to come and get checked. Now in terms of yourself checking it, you can check if the strings are still intact. When you put the coil, there are those strings that hang, and sometimes they get lost. They either come out or they coil and go into the uterus. So you need to be checking it using your finger if the coil is still there. You can do it monthly so that it doesn't get lost and you have to be taken to theater to remove it. Can it cause extra discharge? It can cause heavy flow or menstrual bleeding at the initial phase, but most of the time it clears with time. Okay. Number 4, is PID or pelvic inflammatory disease considered an STD? An STD is a sexually transmitted disease. Yes, most common causes of PID, the organisms that cause PID, most of them are sexually transmitted, like chlamydia, like gonorrhea. But sometimes you might be told you have PID and yet it's not PID. So you have to confirm first if it's actually PID. But yes, majority of the organisms that cause PID are sexually transmitted. I've been having recurring piles. Piles, I think, are hemorrhoids. I have used anisole and they disappeared. Then they came back again. After long call, they swell again. How can I be helped? So if you have recurrent piles or recurrent hemorrhoids, you're actually advised to see your doctor so that there could be a cause for the piles. Most of the time, if you get pregnant, it's very common in pregnancy. Sometimes you can have a tumor in the anal region that can be causing the piles, or there could be other causes. So you need to find those causes, because if the causes are still persisting, then the piles, you treat them, you get well, then they recur. So you need to find that lasting solution. And there's also the issue of surgery, which is the last option. Sometimes if the piles get worse, you can be done surgery to clear it. The other question is about family planning. I would like to know more about family planning, the different types and their pros and cons. Now, we will do a whole video around 10 to 15 minutes on family planning, because there's a lot to discuss. The natural methods, the hormonal methods, the non-hormonal. We have what we call the long-term method, short-term method, the natural. So it depends. And we can't do that in just 1 minute. So we'll do a video with that. We'll notify you when you do a whole video on family planning and contraception. And of course, the pros and cons of each. What is your advice for someone who is diagnosed with CIN3? This is a bit technical. CIN3 means it's like a precancer lesion. You see, when you have cervical cancer, okay, let me try to put it in the layman's language. The cervix usually have normal cells, then we have cancer cells. Before you transfer from normal cells to cancer, there's usually a transition period over many years, 5 to 10 years. So in between here, we have precancer cells. So CIN3 is one of the conditions here that happens that, if not treated, might get to cancer. There are different ways of treating it, depending on the age, depending on your HIV status, depending on many other factors, and also your wish in terms of do you still desire to get pregnant in future? So there's no straight answer. You need to visit your gynecologist and you discuss the different treatment options. Is there an age restriction to getting a hysterectomy? Okay, hysterectomy is the removal of the uterus. Is there an age limit? No. Any age removal of the uterus can be done so long as there's an indication. But of course, there's an age you reach, like 90 years, 95 years. We usually consider the risks versus the benefit. Is it worthy taking a 90-year-old woman to theater to remove the uterus? What are the risks of taking her to theater? So even that one, there's no straight answer, but you have to look at the benefit versus the risks. Does the 5-year Implanon cause weight gain? Implanon is the implant that is placed over your arm, and it lasts for 5 years. It's a hormonal method, so it can cause. It's not a guarantee that it will cause weight gain. It can cause weight gain. And in some women, the opposite happens. It can cause weight loss. The other question is about miscarriages. What are the causes and how to avoid them, especially in the early stages of pregnancy. Now, miscarriages are many: first, second, third trimester, but the most common is in the first trimester, and those are the most challenging miscarriages because the most common cause of miscarriages in the first trimester is due to genetic causes, chromosomal abnormalities, and those ones you can only know the cause if you go and test the products that come out. Those products that come out when you're having the miscarriage, they can be tested to check if there's any chromosomal problem or if there's any genetic problem. And if that cannot be accessed, you and your partner can be tested. But we shall advise when you have 2 or 3 miscarriages, that's when you do those tests. When is the right age and time to do egg freezing and the pros and cons? Now, egg freezing means the woman, they retrieve the eggs, that is the ova, from the ovary, and it is stored in the laboratory for some time. Then they might want to conceive later in life, maybe after 3, 5 or 10 years. And there are many reasons why they do it. If someone has cancer and they're being treated, either radiotherapy, and the ovary is at risk of being affected, you can retrieve the eggs. If maybe you want to start having children after 40, 45 years, we know celebrities who've done that. They have children at menopause. It's because they froze their eggs early enough when the ovary was still, the eggs were still viable. The only cons about it is the cost. It might be expensive to retrieve and also to store the eggs, and also during the retrieval of the procedure, maybe it's a little bit of pain or discomfort, and you might be given hormonal drugs, which could be having some side effects. When is the right age and time to do it? If possible, you know, the eggs, as you get closer to menopause, the eggs reduce in terms of quality and quantity. So you don't want to retrieve your eggs when you're at 40 and above. So the earlier, the better. If I have recurring breast lumps that are not cancerous, should I get them removed? If they're not cancerous and they're small, you'll be advised by your doctor, depending on what was seen during the test. There's what you call the histology. They get a small part of the lump, they go test it and find. If it's not cancerous, not increasing in size, no need for removing. But if it's big and you're bothered, and maybe you have a family history of breast cancer, you'll be safe to remove it. Can abortion done 8 years ago cause infertility? Abortion by itself doesn't cause infertility, but it can be a complication of the procedure or the process under which it was carried out. Let's say if you had a miscarriage and you got an infection, then that infection affects the womb or the uterus, or it affects the tubes. That one can cause infertility because the infection can persist and might cause changes in the uterus and the fallopian tube. It can cause blockage of the tubes. So you need to get checked, and during the miscarriage, if there is risk of infection, you get antibiotics. The other reason you can get an infection is the procedure itself. During that miscarriage, there's what you call the evacuation. If the evacuation is done and the process is not sterile, and you pick an infection at that time, and the infection persists, it can affect your womb. But miscarriage itself rarely causes infertility in future. This question is very interesting. Can one get pregnant during perimenopause? Perimenopause means the transition period just before you get into menopause and just when you get into menopause. So it's a period of majority around 45, can come earlier 42 years. So can someone get pregnant? Yes, if you're having your periods and your eggs are there, you can still get pregnant. Can one get pregnant immediately after a miscarriage? Yes, you can get pregnant within 2 weeks after a miscarriage. That means you ovulate before your next period. So we usually advise after a miscarriage, if you don't want to conceive immediately, you rather use a family planning method to postpone getting pregnant, or you abstain, or you practice protected sex until the time you get your period. Now you can plan from there on. So you can get pregnant immediately after a miscarriage. I think I've exhausted the one last question. Speak about endometriosis. Now, endometriosis is quite wide. We even have a video on our YouTube channel, Modern Gyno Clinic. We request you to visit our channel. There's a whole video, I think it's 15 or 20 minutes, discussing about endometriosis, what it is, the treatment, the causes, the symptoms, and the management. And you'll get a whole information about endometriosis. Thank you for today. I think I've exhausted all the questions. We continue educating you. We continue informing you. If you have any questions, you can only drop them in our site. We are on Facebook as Modern Gyno Clinic. We are on Instagram. We have our website, and it's being shared on the screen. You can always ask the questions. And we'll be organizing these special sessions. We'll organize also one-on-one questions with our clients and even our patients. We will answer you satisfactorily, and where it's not clear, you can come one-on-one to seek further redress. From Dr. Karanja, thank you very much. God bless you.